Okay, so if you're one of those individuals and you're loaded up on medications and they keep giving you more drugs to treat more symptoms of the problems you have, it's all about lifestyle. And this proves it right here. This article, this is in Diabetes Control, was put out 22 years ago. And it says here, fasting blood sugar above 90 puts you at risk of heart disease. So the study shows a fasting blood glucose of above 100 increases risk of heart disease by 300%. People with fasting blood sugar levels above 100 to 125 have an adjusted nearly 300% increased risk of having coronary heart disease than people with a level below 79. That's mine. This information was compiled from cross-sectional study in nearly 2,500 people. The fasting blood sugar level more than 125 is the current threshold for identifying patients with diabetes. But the new findings suggest that patients with high levels of blood sugar in the non-diabetic range face a substantial risk of coronary heart disease. Now, here's some information for you, ladies and gentlemen. 80% of men and women my age and above are diabetic or pre-diabetic. And that's from the CDC. 80%. You fall in this category. And pre-diabetes means 100. You fall right here. It says the Cleveland Clinic Foundation now uses, and again, this is 22 years ago, fasting blood sugar of 90 milligrams or higher as a biomarker of coronary heart disease risk. The Cleveland Clinic gets very concerned when they have someone with a fasting blood sugar above 90. They try to intervene with exercise, diet, and weight control. The previous cutoff of 125 was based on the incidence of diabetic retinopathy, but physicians are now increasingly focused on diabetes-related risk of coronary heart disease. As evidence continues to grow in this area, it is likely the definition of diabetes will change. Normal fasting blood glucose is below 100. A person with prediabetes has a fasting blood sugar above that. If it raises above 126, they're full-blown diabetic. Why should we wait for patients' blood sugar to get above 100 before we are concerned? Prediabetes is far easier to turn around in the early stages than later stages. It says amazingly 25% of obese children under the age of 10 have either blatant or pre-adult diabetes, type 2. 1/4 of the obese children under 10 in the U.S. may have diabetes. And it goes on and on about this. And it's because of the diet that we're pushing on people. I shop for the family. I enjoy shopping. I like talking to people. And I'm in Fry's, and at the end cap, one of the aisles is a cereal, Honey Nut Cheerios. And on the front of that cereal, the box right in the center of the label, it says Dad. And they're promoting that cereal as heart healthy. It's nothing but carbohydrates. It's nothing but sugar. So you take people who don't listen to my show, who get this information, and don't get this information, I should say. They don't know. So they see this, say, Dad, you got heart issues. You need to be eating Honey Nut Cheerios. Wrong message. Heart healthy? Give me a break. Read the label. See the number of grams of carbohydrates. That's not heart healthy. That's a heart attack waiting to happen. I'm not making this stuff up. Blood sugar above 100, 300% increased risk. 300%? And like it says here, they don't do nothing until, you're diabetic now, and I'll take these medications for it. Instead of changing your diet and exercising, and as I referred to earlier from the article about baby boomers, my generation, we're exercising less and getting more weight. 40-inch waist for men, 38 for women. That's not acceptable. And again, I'm not picking on him. I'm just stating if someone needs to say it. So if you look down and you see your waist and you can't see your feet, you got a real problem. But if you look down and you can see your feet, but you got this bump growing out, and you're not pregnant, which you shouldn't be at our age, you got a problem too. And the only way to address that problem is to look it right in the face and say, I need to do something. Because sooner or later, that's going to catch you and bite you in the butt. And you'll have all kinds of health issues. You do not want to be declared a diabetic. Because once you get to that point, they'll load you up on all kinds of medications. And usually it's not one, it's 2 or 3. Then you get to a point, oh, you need insulin too. Now you're really in trouble. Because insulin traps fat. In other words, when insulin goes up, you don't burn fat. And people that are type 2 diabetics or pre-diabetics already have high levels of circulating insulin. 3 to 5 times normal. That's fasting now, when they're not eating. And that insulin locks up fat. It also tells the liver to make cholesterol. It also is involved in the inflammatory processes in the body. In other words, inflammation, pain. It also is involved in aging of your cells, advanced glycation end products. In other words, sugar-coated cells in the body. Everything. Sugar-coated. Glucose. Insulin's tied to that. It's also involved in Alzheimer's disease, in Parkinson's, all your neurological disorders. They're all doing studies right now. Harvard's doing a big one, I guess, on all these mental health issues using a keto diet. And they're seeing incredible, I am not making this up, incredible results from it. Look it up. From bipolar disorders, you name it, alcohol issues, addictions, low-carb diet. The brain uses ketones for energy. Ketones come from fat. When your blood sugar goes down, insulin goes down, ketones are released to be used for energy. The whole body can use ketones for fuel, particularly the brain. You ever wonder why God created the brain to use 2 sources of energy, sugar and fat? It's because our ancestors did not have access to food that we have today. There's times where they famine. You realize you can go 5 weeks without food? 5 weeks without eating. What are you living off of then? Well, you need to eat carbohydrates. Well, that means you'd be dead pretty soon because you only store so many of that. 2 grams of carbohydrates per 1 pound of muscle, glycogen, per 1 pound. So if you're 100 pounds of muscle, that would be a lady, that's 200 grams. That's it. So if you had to have these carbs, if they were essential, you can't go more than a day or so, and you're dead for 5 weeks because you need to use fat for fuel. That's ketones. The brain and everything needs to be functional on ketones. The heart can use ketones for fuel. It likes it.